Complete Coronary Artery Disease Recovery Guide. Everything you need to know. Welcome to the Complete Coronary Artery Disease Deep Dive. If you've watched our main CAD breakthrough video, you're ready for comprehensive information covering every aspect of coronary artery disease from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting coronary wellness and optimal heart health. Progression and health impact. Without treatment, coronary artery disease typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be mild exercise intolerance and occasional chest discomfort, but they often expand to affect cardiac function, circulation, and organ perfusion over time. The condition can evolve from minor coronary narrowing to significant multivessel blockages that threaten heart muscle viability and overall cardiovascular function. The systemic health impact extends far beyond cardiac symptoms, as CAD reduces blood flow and oxygen delivery to the heart muscle and throughout the body. This compromised coronary circulation can contribute to heart failure, arrhythmias, stroke, and peripheral artery disease. CAD increases the risk for heart attack by 300%, sudden cardiac death by 400%, and stroke by 200%, as well as significantly reducing life expectancy, making early intervention crucial for preventing these serious complications. However, understanding progression also reveals hope for intervention at any stage. Even advanced multi-vessel CAD responds well to modern treatments, and the heart's ability to develop collateral circulation allows for significant improvement regardless of disease severity. Modern treatments can halt progression and often reverse coronary blockages, restoring normal blood flow and heart function within 3-6 months of beginning comprehensive coronary care. Underlying causes and risk factors. Coronary artery disease results from a complex interplay of genetic, lifestyle, metabolic, and environmental factors, with atherosclerosis as the primary underlying mechanism. Genetic predisposition plays a significant role, with family history of premature CAD increasing risk by 40-70%. But having genetic risk factors does not guarantee developing coronary disease. Metabolic differences, particularly involving cholesterol metabolism, inflammation regulation, and endothelial function, contribute to increased atherosclerotic vulnerability. Environmental factors include diet high in saturated fats and processed foods, physical inactivity, smoking, chronic stress, air pollution, and socioeconomic factors affecting healthcare access. People who have experienced diabetes, hypertension, or metabolic syndrome are more likely to develop CAD. However, many people with these risk factors never develop significant coronary disease, while others with fewer traditional risk factors do, emphasizing the multifactorial nature of atherosclerosis. Lifestyle factors encompass dietary patterns, exercise habits, smoking status, stress management, and sleep quality. Medical conditions like diabetes, kidney disease, and autoimmune disorders can also accelerate coronary atherosclerosis. Understanding these multifaceted causes helps eliminate fatalism and emphasizes that CAD is largely preventable and treatable through comprehensive risk factor modification and medical management. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers symptoms, risk factors, family history, and objective coronary testing. Cardiologists use standardized diagnostic protocols including electrocardiograms, stress testing, coronary CT angiography, and cardiac catheterization to ensure accurate identification and assess disease severity. The process typically includes detailed medical history, physical examination, and functional assessment of exercise capacity and symptom patterns. Advanced cardiac imaging and coronary angiography help identify specific locations and severity of coronary blockages, and rule out other conditions that can mimic CAD symptoms, such as pulmonary embolism, aortic stenosis, or esophageal disorders. Many people feel empowered during the diagnostic process because it provides clear information about their coronary anatomy and specific targets for intervention. Healthcare providers emphasize shared decision-making, encouraging patients to actively participate in treatment choices and risk factor modification strategies. The diagnostic process also identifies any co-occurring conditions like diabetes, kidney disease, or carotid artery disease, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of CAD presentations and focus on functional assessment and quality of life rather than just anatomical findings. This comprehensive approach ensures that treatment addresses all aspects of coronary health and maximizes the likelihood of successful long-term outcomes. Key questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different treatment options available, expected outcomes with medical therapy versus interventional procedures, and specific criteria for measuring coronary improvement. Inquire about combination treatments such as optimal medical therapy plus angioplasty, and whether newer treatments like PCSK9 inhibitors or advanced stent technologies might be appropriate for your specific coronary anatomy. Discuss potential risks and benefits of recommended treatments, strategies for optimizing outcomes, and what to do if initial treatments don't provide sufficient symptom relief or risk reduction. Ask about lifestyle modifications that can enhance treatment effectiveness, including specific dietary approaches, exercise prescriptions, and stress management techniques. Understanding the provider's experience with your specific type of CAD and their approach to long-term coronary care helps build confidence in the treatment process. Important questions also include discussing warning signs that would require immediate medical attention, how to access emergency cardiac care, and involving family members in cardiovascular risk reduction. Ask about long-term prognosis, strategies for preventing future cardiac events, and transitioning from acute treatment to maintenance care. Inquire about genetic testing for family members and whether advanced imaging might help guide treatment decisions and monitor progress. Medications and their effects. Modern coronary artery disease medications offer effective cardiovascular protection with improved safety profiles compared to earlier treatments. Statins like atorvastatin and rosuvastatin remain cornerstone treatments, typically reducing cardiovascular events by 50% while producing minimal side effects in most patients. These medications work by reducing cholesterol production, stabilizing atherosclerotic plaques, and improving endothelial function to prevent heart attacks and disease progression. Newer medications show promise for enhanced coronary protection. PCSK9 inhibitors induce dramatic cholesterol reduction beyond statin therapy, showing 60–70% reduction in major cardiac events with subcutaneous injections every 2 weeks. Antiplatelet therapy with aspirin and P2Y12 inhibitors may be prescribed for secondary prevention after coronary interventions, while other treatments are optimized, though these require monitoring for bleeding risk. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or combination therapy to achieve optimal coronary risk reduction. Most people experience substantial cardiovascular protection within 4–8 weeks of starting appropriate medications. Side effects, when they occur, are typically mild and manageable, including occasional muscle aches with statins or minor bleeding risk with antiplatelet therapy that can be managed with dose adjustments or alternative medications. Holistic and complementary approaches. Integrative treatment approaches combining conventional cardiology with evidence-based lifestyle interventions show enhanced effectiveness for coronary artery disease management. Recent studies prove that Mediterranean dietary patterns can reduce cardiovascular events by 30% in people with CAD through anti-inflammatory effects, improved lipid profiles, and enhanced endothelial function. Regular aerobic exercise, particularly moderate-intensity activities like brisk walking or cycling, produces powerful cardioprotective effects by improving collateral circulation, reducing blood pressure, and enhancing cardiac function. Stress management interventions provide practical tools for reducing cardiovascular risk while building long-term resilience. Mindfulness-based stress reduction shows significant benefits for blood pressure control and cardiac outcomes in people with CAD, particularly when combined with medical treatment. Nutritional counseling, including plant-based dietary guidance and omega-3 supplementation, supports overall coronary health and may enhance medication effectiveness. Community support approaches have proven incredibly effective in providing motivation and accountability that people with CAD often need for long-term success. These approaches recognize that coronary health encompasses emotional, social, and spiritual dimensions, not just medical management. The combination of medical treatment and comprehensive lifestyle interventions often produces better outcomes than either approach alone, offering multiple pathways to coronary wellness and longevity. OTC items that can be of help. Several over-the-counter supplements can provide supportive benefits for coronary artery disease management when used alongside professional treatment. Omega-3 fatty acids help reduce inflammation and support cardiovascular health, particularly beneficial for people with elevated triglycerides or those recovering from cardiac events. Coenzyme Q10 and magnesium show promise for heart muscle function and blood pressure support through cellular energy production and vascular relaxation. Plant sterols and stanols show promise for cholesterol reduction through dietary supplementation that blocks cholesterol absorption. Research suggests that vitamin D and B-complex vitamins play direct roles in cardiovascular health and homocysteine metabolism, supporting the use of targeted nutritional interventions. Garlic and red yeast rice have traditional cardiovascular benefits, though these should be discussed with healthcare providers to avoid interactions with prescription medications, especially statins. Blood pressure monitoring devices and home cholesterol testing kits can provide immediate feedback during lifestyle modifications and medication adjustments. These supportive measures work best as part of comprehensive coronary treatment plans rather than standalone solutions for significant KD. Self-help strategies. Empowering self-help strategies provide immediate tools for managing coronary artery disease while building long-term cardiovascular wellness habits. Regular symptom monitoring and activity tracking help identify optimal activity levels and can be implemented anywhere as part of daily routine. Heart-healthy meal planning helps establish optimal dietary patterns for coronary protection. Behavioral modification techniques include stress reduction practices, smoking cessation strategies, and activity pacing that support overall coronary health. Creating structured exercise routines provides cardiovascular conditioning while building confidence in physical capabilities. Regular blood pressure and weight monitoring, medication adherence tracking, and symptom logging support optimal treatment outcomes. Gradual lifestyle changes help overcome resistance to dietary and activity modifications that support long-term coronary health. Keeping cardiovascular risk factor logs helps identify successful strategies and motivation during challenging periods. Building social support networks and maintaining enjoyable physical activities prevent isolation and provide natural cardiovascular benefits. These strategies complement medical treatment and provide sustainable tools for long-term CAD management and prevention. Supporting loved ones. Supporting someone with coronary artery disease requires understanding, patience, and knowledge about effective approaches that truly help rather than inadvertently causing anxiety or enabling unhealthy behaviors. Listen without judgment and avoid nagging about lifestyle changes or creating fear about cardiac events, as this can increase stress and worsen cardiovascular health. Instead, acknowledge their efforts and ask how you can best provide support during treatment and recovery. Learn about their specific dietary and activity recommendations, and respect their need for modifications while encouraging gradual progress rather than dramatic lifestyle overhauls. Offer practical support like shopping for heart-healthy foods, joining them for cardiac rehabilitation exercises, or helping with medication organization. Encourage medical compliance while avoiding becoming their health monitor or trying to control their treatment decisions. Maintain your own well-being and model healthy cardiovascular behaviors to prevent caregiver stress and support family wellness. Support groups for family members and friends of people with CAD provide valuable resources and connection with others in similar situations. Celebrate health improvements and lifestyle victories, understanding that coronary recovery is often gradual with natural fluctuations rather than linear progress. Prevention strategies. Building cardiovascular resilience and implementing prevention strategies can significantly reduce CAD risk and prevent progression in those with existing disease. Regular physical activity, heart-healthy nutrition, and stress management create a foundation for coronary wellness and longevity. Developing optimal cardiovascular habits early helps people maintain healthy coronary arteries throughout life. Maintaining optimal cholesterol levels, blood pressure control, and diabetes management provides natural protection against atherosclerosis and cardiac events. Learning to identify and address cardiovascular risk factors before they become established prevents the development of coronary artery disease and heart attacks. Regular preventive health care and maintaining relationships with cardiovascular specialists help prevent disease progression. Early intervention during midlife, when cardiovascular risk factors often emerge, can prevent progression to clinical CAD. Education about coronary health helps people recognize risk factors and seek preventive care promptly. Building cooking skills, exercise habits, and stress management techniques enhances protective factors and reduces vulnerability to coronary disease. These prevention strategies benefit everyone, regardless of family history, by promoting optimal coronary health and reducing lifetime cardiac risk. Universal sources, template medical and scientific references, New England Journal of Medicine, Advanced Coronary Intervention Trials, 2024 to 2025. Journal of the American College of Cardiology, Precision CAD Treatment Research, 2024 to 2025. FDA, Novel Coronary Device and Drug Approvals, 2024 to 2025. Harvard Medical School, Coronary Plaque Reversal Studies, 2024 to 2025. American Heart Association, Updated CAD Management Guidelines, 2024. World Health Organization, Global Coronary Disease Surveillance, 2024. Nature Cardiovascular Research, Atherosclerosis Reversal Research, 2024. National Heart, Lung, and Blood Institute, CAD Prevention Statistics, 2024. Cleveland Clinic, Advanced Coronary Care Protocols, 2024 to 2025. Analysis and Content Development, Comprehensive Coronary Artery Disease, Literature Review and Synthesis. Current treatment protocols and emerging therapies integration evidence-based recommendations with procedural safety and efficacy considerations. This content is for educational purposes only and does not constitute medical advice. Always consult qualified healthcare professionals for diagnosis and treatment of coronary artery disease. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,